Hello guys, I am Dr. Chandani and I'm currently doing my internship. My internship is almost going to be over, so today I'm going to be talking about my experiences in internship here in. Now, having said that, it is a phase where everyone's expectations, experiences are very different and deeply personal. So, here's mine. Now I started off my internship with the posting in medicine. So this is a posting which is the most hectic and I learned the most. Now in the initial few weeks we usually write a lot of forms, collecting reports, doing ECGs. But once we start to settle in, we start getting procedures like ascitic tapping, pleural tapping, and if we are lucky and there are a lot of patients, we also get lumbar puncture, bone marrow biopsy and aspiration. And since this was my first posting, I also learned NG tube insertion, Foley's insertion, removal, all the basics. Now, this is the ward work. During our emergency 24-hour duties, we are responsible for all the patients. So, when things go wrong, sometimes we also get to give CPR, emergency resuscitation, usage of emergency drugs, and all of that. And after our ward work is done, we can also go to OPDs. Now, I want to highlight this that the professors are really good, calm with us, and they're quite patient to teach us the OPD stuff like seeing patients, history taking, prescribing medications for basic illnesses like gastritis, diabetes, hypertension, and all of that. Now, after this, I went to surgery, and in surgery, we get to rotate between OTs, wards, and OPDs. Now, in OTs comes our first scrubbins, our first suturing, and I assisted in a lot of laparoscopic and open surgeries. I also learned how to hold a suction, which I will never forget. Then in wards, we usually do a lot of dressings like post op patients, bedsore patients. And during my time, there was a patient with burst abdomen. So we used to do daily dressings for him. Now, in OPDs, mainly there are a lot of hemorrhoid patients, so we learn how to manage it. And if you show a lot of interest, you will also get to learn PR examination. And if not, then the JRs are gonna do it. Now, in between of my medicine posting, I also got a week of derma. During my time, there was a patient with pemphigus vulgaris, and I helped the PG in doing the dressings. Then, in the OPDs, we usually learn how to give steroid injections for keloid, then tattoo removal using laser, and observed skin biopsies. Yep, all of that. Then it was time for my short postings, which are for 2 weeks each, and I started with emergency. Now, this is a place which is very chaotic sometimes. We get to see all kinds of patient presentation from road traffic accident to stroke and obstetric emergencies. And I also got to learn about MLC and non MLC cases. I remember in one of my night duties, I got to do a suturing of a road traffic accident patient. And cannulation is something that I learned in emergency from the nursing staff. So I'm very grateful to them. After this, I went to forensic for a week, and here mainly the teachers, the PGs, are gonna take classes for you for all the important topics and revise it. Along with that, I also got to observe two autopsies that were being held during that time. So that was my posting. Next was orthopedics. So in orthopedics, we get to rotate between OTs and wards. During OTs, we usually don't do much. We sit and we observe the surgery. Once I got to scrub in for a CTEV correction surgery, so I remember that. And in wards, we usually make a lot of discharges. Next was Opthal, and Opthal I only did for 5 days. Rest days are in extension because I went home. Now, during the time that I was here, I attended OPD and I mainly made discharges. Now, next was psychiatry. This was a posting which was very different from others because here we get to see patients with mental illnesses. We learn how to elicit history, how to talk to them, and we also observe patients with common mental problems like anxiety disorders, panic disorders, depression, alcohol abuse, and it just makes you realize that how important mental health is. So always pay attention to your mental health. After this, I went to ENT. So here interns mainly sit in the OPD and attend patients with common complaints like common cold, allergic rhinitis, tonsillitis, acute pharyngitis. So we see patients, we get to do examination, and we learn about some common medications. So that was my ENT posting. Anesthesia was a posting that I really liked so much out of all the postings, because here we get to do a lot of procedures and learn bag and mask ventilation, then spinal anesthesia, endotracheal intubation. So there was a lot of hands on in this posting, and the professors were very patient with us. So it was a good posting. The only thing I did not like was sitting in OTs for so long, like for the entire day. Then it was time for OBG postings. Dude, 7 weeks, okay? So we used to do 24 hours in the labor room, and it used to be always busy and chaotic. So in the morning we do NSTs, then writing a lot of forms, collecting reports, assisting in minor procedures like MTPs, biopsies, NVDs, and then in our hospital there are a lot of emergency LSCS cases. So there will be emergency OTs during odd hours at night. So there was no sleep during those times, and it used to be very tiring. Now, during our ward duty, we used to usually do a lot of dressings, suture removals, and prepare a lot of discharges. OPDs were a total nightmare. I hated it, because imagine writing forms from 9 in the morning till 4 in the evening. So I didn't like that. Pediatrics. Now, this was the time when I got the worst skin allergy, and I had to go home for a few days. I was sick, my energy was really low. But for the days I attended, we get to rotate between pediatric general ward, ICU, postnatal ward, and OPDs, and we kind of get all kinds of exposure by seeing our seniors doing all kinds of procedures. For me, I got to do neonatal resuscitation once in the ICU, so that was it. And we also like basically get the gist of the department, like how is pediatrics and what kind of medications are given, what kind of cases are there in the wards. So that was my posting. Now, next was radiology. Here we get to rotate between x rays, MRIs, CT scan, and ultrasound, and we basically observe like how these procedures are being done and how the patients are being followed up. Now, the last posting is community medicine, which is going on right now. I'll be soon going to UHTC, and after that, I'll be going for my rural postings, which I'm most excited about. So, we go to Ribhoi, which is a district in Meghalaya, for our rural postings. That was my internship experiences, and I hope you had fun watching it, and thank you so much for watching. Please subscribe to my channel, and I will see you guys next time. Bye bye.